I did chemo, I did radiation, I did double mastectomy, just so many things, and it was all so fast.
Pender of Virginia Beach recalls her personal journey 11 years ago when she was diagnosed with breast cancer.
It was very difficult. Because there's a lot of stigma that's involved with breast cancer as well, especially in African American women. We're taught to be strong from the very beginning, and we're taught to, be a superhero.
Now, 10 years cancer-free, her mission is to educate and help others in her home area, especially when it comes to disparities among Black women.
God saved me and blessed me, so I need to do the same by trying to do whatever I can.
According to the American Cancer Society, breast cancer is the most common cancer diagnosed in American women and the second leading cause of death from cancer among women.
So I just left a patient's room 10 minutes ago, somebody who has a newly diagnosed breast cancer.
Dr. Mary Beth Hughes, the chief of surgical oncology with Eastern Virginia Medical School, says it's not uncommon for her office to have several breast cancer patients.
We have one of the highest rates of triple negative breast cancer in the country, and that is the most aggressive form of breast cancer.
EVMS doctors are also getting the word out about this recent report by Susan G. Komen detailing disparities among Black women in the Tidewater area and how we compare with other areas across the country. The report names the 10 U.S. metropolitan areas where Black breast cancer disparities are the greatest, one of those being the Tidewater region.
That just brings it home.
Dr. Milton Brown is the Vice Dean of Research at EVMS and has been keeping tabs on how prevalent breast cancer is in Southeast Virginia.
This is in my backyard. I care.
The study also found in 4 out of 8 cities or counties in the metropolitan area, when compared with white women, Black women experienced lower breast cancer incidence rates, or rates measuring the number of new cases in a specific time period. However, Black women had higher mortality rates. Also, both Suffolk and Chesapeake experienced the biggest disparities. And take a look at this map in the report. Newport News, Norfolk, Hampton, and Portsmouth show concentrations of late-stage breast cancer diagnoses, with most cases being Black women.
When you think about what impacts cancer rates, first, genetics. There's social and economic determinants for that as well. There's environmental determinants.
Which is why others like Dr. Brian Martin believe an emphasis on screening is key.
Some of the things from a public health perspective that we would worry about is what would prevent a woman from getting screening. So number one, it could be that she just doesn't know about it. So education is very, very important.
As for EVMS, Brown says their study on Grail's Gallery multi-cancer early detection test I told you about last month could help tackle local breast cancer.
This is a new way of going after breast cancer research because you're focusing in on women who have not been diagnosed with breast cancer. That's early detection. That saves lives.
Early detection is key.
As for Pender, she's hopeful for EVMS's work as she'll continue sharing her experiences and help others navigate their journey. And Pender says she'll be involved with this year's Making Strides Against Breast Cancer event at the Virginia Beach Oceanfront on November 4th. Now, if you'd like to learn more about how prevalent breast cancer is here at Hampton Roads and how EVMS is providing health literacy tools to our community, you can find that out right now at WTKR.com. In Norfolk, Zach Dahlheimer, News 3.
If you are looking for a place to get your mammograms done for free, here's a heads up. Chesapeake Regional Healthcare offers them year-round for people who qualify. Now, if you want to learn more about how to set one up, we have that contact information, everything you need to know inside Zach's story on WTKR.com.